Welcome to Vaso-Meditech EECP Treatment Center. Today in this video, we are going to discuss about how cardiac risk factor affects your heart. So many people know the cardiac risk factors are very important, and some of the important cardiac risk factor which can decide your future risk of heart attack is diabetes, high cholesterol, high blood pressure, obesity, lack of exercise, sedentary lifestyle, smoking and stress. So these all will follow a common pathway. So this pathway will lead to the heart disease in the later stage of your life. So these risk factor, if it's present for a long period of time, let's say in couple of years, so eventually it will start affecting your heart. So how does this risk factor affect the heart? So what really happens is, when all this risk factor or some of these risk factors are present in you, what it will does is it starts affecting your arteries. Arteries means your entire blood vessel in your body. It not only your heart blood vessel or kidney blood vessel or your brain blood vessel, it involves the entire vascular system or entire vessels. So once it is done, what will happen is your vessel becomes stiffer and stiffer. It means it becomes so thick, it loses its elasticity. So elasticity is one of the important function of your vascular system or your blood vessels. If the elasticity is lost, then what will happen is the blood flow start injuring the vessel, which we call endothelial dysfunction, or injury can happen within the blood vessel. And this injury can also happen throughout your vascular system, not specific to your heart or your kidney. So when this injury starts happening, then the blood vessel become very stiff with calcium deposit or sometime inflammation, and it can also lead to what we call as blockage. So the injured vessel will start accumulating fat and forms blocks, and these blocks can happen anywhere. When it is happen in your blood vessel, in your heart, it will cause a heart attack. When it happens in your brain, it can cause a stroke. When it happens in your renal system, it can cause a renal failure. So once these blocks are formed, then the blood flow is insufficient. This is how the risk factor affects the blood circulation. But at the same time, because your vessel is become stiffer and stiffer and losing its elasticity, the heart will find it harder to pump the blood into this stiff vessel. So this will overload the heart with more and more effect, and eventually this can also result in serious heart disease. So you have to make sure this risk factor, once identified, has to be kept under control and should not progress. If you achieve that, your risk for heart disease, stroke and kidney failure and all the disease which is related to your vascular system could drastically come down.